Any views, thoughts, and opinions expressed on the Rejuvenating Health podcast are solely those of the speakers and are intended as such. Please consult your trusted healthcare practitioner for medical advice. Let's go, girls.
Hello, ladies. Welcome back to the Rejuvenating Health podcast. I am Coach Lakin, and as always, I'm joined by nurse practitioner Lindsay. And today we're going in a little bit of a different direction than what we normally do.
Yeah, I mean, I feel like it's been a hot minute since you and I have talked about our health journeys and stories and why we are so passionate about rejuvenating health and so passionate about why we do what we do. Because let's be honest, like truthfully, we both come from like a health coaching space first. You didn't get into mindset one day by saying, I want to do mindset coaching.
Right.
And I didn't get into functional med by just one day being like, I want to do functional medicine. Like we both started as like health coaches and worked our ways up from there. Right. And so at the end of the day, like we know how important health coaches are. We've had health coaches before, but that's because we both have had a journey, right? Like you didn't wake up one day and you're like, so I don't even know what to say. Like you didn't wake up wise and be able to like help people with their stories. And I didn't wake up one day just knowing how to treat people and treat their complex problems. Like we went through stuff to get us where we are at today.
Yeah, almost like an external to internal approach.
Right. And
it's like a lot of it was very focused on like external and what could be seen outwardly for a period of time. And then what we see over time is like fitness is like a gateway drug, right? And then we slowly start to turn more inward. It's like, what is actually moving the needle? What are the things that are actually making the change?
Yeah. And if you look back at it, like neither one of us got in this to make money either, because if you've ever done health coaching, you know that like when you're first starting out, you don't make crap. You do it because you love people and you really want to help people. So this is just like a different kind of episode. Like I know I get questions all the time from people like, how did you start Rejuvenating Health? Like our clients specifically ask that like on our group calls. So if you're a client of ours or you are considering working with us or you have a call scheduled with us, I want you to kind of think about this as like a getting to know us, but then also like you're going to learn a lot from this podcast. You're going to learn a lot about what we've went through, but then also like the way that we think about things and all of that type of stuff.
Yeah, it's like a pre-call conversation, like a little look under the hood or behind the curtain.
Yeah, and it like hopefully will give you some insight on some of the heart behind what we do, like some of the things we see every day and how we really are super integrative and how like taking control of your health really can change your long-term outcomes.
Yeah, and what we've also seen across our industry, not only now, but previous versions of it, especially like in the fitness and health and wellness industry over time, and the things that are effective and the things that we wanted to incorporate and the things that were like, nah, not so much.
Exactly. And so we hear this every day, like same story over and over, kind of, but everyone has their own unique story as well. But I'm exhausted. I can't lose weight. My labs are normal, but I feel terrible. I've went to the doctor and they can't help me with anything. I've tried all these numerous things and nothing works. And hello, we both feel you.
And a lot of that gets minimized like that. And that's a big part of the reason why we have such an all-encompassing approach, because so many times women struggle with symptoms and then either culturally they think that it's no big deal because it's just a part of what happens, or they do seek out advice or, medical attention and they're told that it's not a thing that they need to be worried about, or it's just normal, or it's just something they have to deal with, and it gets minimized over time.
Yeah. And these things, I did a call with someone today and I'm like, you're having all these symptoms because you're like chasing some magic thing and taking all these supplements. And at the end of the day, you don't have any estrogen. And so you don't have any stomach acid. And that's why you feel terrible. But no one's told you that. You're 47.
Yeah.
And these symptoms are not random. They're signals. And if they're left untreated, you're going to have gut health issues. You're going to have insulin resistance that leads to type 2 diabetes. You're going to have a hormonal imbalance that leads to a really decreased quality in life. You're going to have thyroid dysfunction that leads to your chronic fatigue and that you can't function as a mom and a wife and an employee. You're going to have chronic inflammation, which makes it to where you can't go to the gym or that you get some kind of chronic immune disease.
Yeah. And ideally, we're not just putting a Band-Aid on these things. It's not something that's just about making the symptoms feel better. We want to look at prevention and also getting to that root cause that we talk about a lot.
Exactly. And so I think it's important to know like why Rejuvenating Health started. And so I was trained in conventional medicine. Like, no one goes into medicine thinking they want to go the functional medicine route, but we all have some kind of backstory. So my story is like super complex. It started when I was 16. I had some major gut health issues. I like had my first colonoscopy at 16, was put on an immunosuppressant, which those are really dangerous. Like, I'd have to get my blood count checked every month. I have to get a CBC. I had to be careful about not getting sick, all of that type of stuff. And then at that time, I was also going through a lot of trauma. So looking back, I'm like, okay, well, my gut health issues were probably tied to like the bullying and trauma that I was going through at that time. Because of that trauma and bullying, I developed a really severe eating disorder. And that eating disorder lasted from age 16 to really age 23. And when I was 20, it almost took my life. Like, I got down to 79 pounds. I was puking multiple times a day. Anything I put in my body, I was taking, laxatives. I was throwing it up. So like the day I got hospitalized for my eating disorder, they told me that if I would have thrown up one more time that day, I would have had a heart attack at 20. So like my relationship with food was not good. I grew up in a household. I love my mom. She's amazing, but we were chronically doing Weight Watchers. Like, it was a very diet household, low fat, Weight Watchers,
Yeah, like the
chronically.
messaging around food was like,
Yeah.
proceed with caution.
Like, think
Yeah.
about then. They're doing aerobics and, it's just like not a healthy environment. And it wasn't her fault. It's just the way that society was at that time. And so, not a good relationship with food, not nourishing my body, really complex gut health issues. Like, I'm not joking. Like, I would go running and I would like poop my pants. My gut was so bad. And nothing that I did would work. And I'd keep going to the doctor and they just keep like slapping on medications. And so luckily God got me pregnant. Like, probably didn't think that was lucky at that time, but it like helped me get over my eating disorder. And I'm like, to be honest, my relationship with food did not heal probably until I was like 35 years old, like really healed.
Yeah.
Whenever I started like finding CrossFit and quit it obsessively running and doing all this stuff and really learned that like muscle is medicine. And that's what like when I would say I like really and learned about food when I really healed my relationship with food. But in the meantime, like I was either pregnant or breastfeeding for 7 years. And when you're pregnant and breastfeeding and you have an autoimmune condition, your autoimmune condition calms down because your body doesn't want to attack itself. It's trying to protect itself from a baby. For 7 years, I'm like, okay, my gut is great. This is awesome. And then I had Gannon. And then I was done breastfeeding and I went to nurse practitioner school. And so, hello, here comes like tons of stress. Here comes tons of gut health issues. Plus, I was training.
You're also raising 3 children.
And running marathons. Like, how much stress can you put on your body? Not eating healthy because, you're fueling with carbs, gluten, dairy to try to like fuel your runs. So, colonoscopies, doctors, here's your meds. Here, like, no one would look in deeper and be like, dude, what is going on with your gut? Because at the end of the day, I have an autoimmune condition called lymphatic colitis. You can totally control autoimmune conditions with diet and stress management and the right supplements. And so I really healed my relationship with food. I healed my relationship with exercise. Like, you can't run like that and have cortisol through the roof. And then I learned things that help with my gut, the right supplements, the right nutrition. Sometimes like some peptides have helped. And it's not like it does flare. Like in times of high stress, I have bad gut. We were in St. Lucia. I ate foods that I do not normally eat. My husband was like, dear God, what is wrong with your stomach? Like it still flares up, but it's manageable now. And so that long story is why I created Rejuvenating Health, because everyone, the doctors were like, something's wrong, but I'm just going to throw some meds on it. And no one asked like, what are you eating? What are you doing? How's your stress? Like, no one thought to look any deeper. And I literally had to treat myself and figure all of this stuff out. But I could have had all that fixed when I was 16 if someone would have asked me about my diet and my stress levels, and someone would have taught me what nutrition is supposed to look like and what fueling your body is supposed to look like, because we should be looking for like root causes of these things. We should be empowering people to fix things, not just managing their symptoms.
Yeah, it's like if there was, I think at the root of this is like there has to be an element of curiosity. If the practitioner doesn't have enough curiosity to say, okay, well, if what I know is not enough, then I need to either outsource and ask somebody that could dig further, or I need to take the volition to dig further, right? Or it's like, as patients or clients or however you want to frame it, right? It's like we also have to have curiosity to say, okay, I'm going to be an advocate for myself. And if you're not telling me what's causing this, not what the symptom is, I'm aware of what the symptom is. And if you're not just going to give me something to offset the symptom, I want to get more involved to understand, how do I fix the thing that's causing the symptom, right? So we're not just looking at it from the back end.
Yeah, and it's the 7 layers of why. It all starts with a why. It's a simple question. And so, like, I know that's how I got into it. What's your kind of backstory then?
Yeah. So alternatively, I can't say that I ever really struggled with food in that sense. Like, yes, I've gone through
Yeah.
periods, when I was younger, where it's like I definitely drank way too much alcohol. And I ate a lot of stuff that like wasn't necessarily good for me, or that I deemed that I thought was healthy at the time based on whatever trends or fads or whatever was prevalent. Everybody goes through that phase in college where they put on some weight, and then I realize, oh my gosh, like this is different. What's happening?
Yeah.
My body's not doing the same thing that it used to. And then shortly after that, I did get into CrossFit, and I started getting into nutrition coaching. And I started to educate myself more on food and what quality nutrition was, and the actual science behind it, not just like, oh, let me count calories or look at this fat or do Weight Watchers or whatever is in style right now. And so as I became more educated on nutrition, I still had a lot of rigidity, though. That was my issue, was that regardless of what it was always this all or nothing approach of like, well, if I'm going to train, then I'm going to compete. And if I'm going to compete, then I'm going to do this. Like, I'm going to go all in. I'm going to work a full-time job. I'm going to coach at the gym. I'm also going to, train for 2 hours a day, 6 days a week. And then I'm going to, count my macros or do intermittent fasting or maximize everything at all times. And it was going a mile a minute and putting all this pressure on my body. And then when COVID hit and the gyms shut down temporarily and I had to rearrange my approach, and then I also had a knee injury, it was a big identity loss. It was like all of the things that I was holding on to that made me who I was, or so I thought, were stripped from me. And I had to reinvent what wellness looked like for me personally, for my body at that time.
You and I started working together. Right?
Yes. Yeah. Because I remember I reached out to you and I was like, listen, I only know how to do things one way, and it's the hard way, and it's not working out for my body anymore. And I need a different approach. And I need to understand like what's going on internally so that I can meet my body with what it needs right now. And I was also like, I was getting older, and I'd put my body through a lot for about a decade of doing things that way, So there were a lot of considerations. And then simultaneously at that time, it was also when I started to take a deeper dive into the internal, as far as, the mindset piece of it and what was going on psychologically, not only for myself, but also for my clients. My clients at the time, the world was shut down. We had all this stuff that was very different than the norm. And it was like this pattern interrupt where everyone was starting to look at things a little bit differently and internalize things, or take a beat to question, which was really good. But I realized I needed more tools to be able to meet my clients with the things that they were bringing to the table to talk to me about. And so that's where this kind of segue of nutrition into life coaching, into NLP, into specifically mindset, and specifically women's mindset, right? But I was healing my own body externally to the internal, like I said before, like kind of coming in to myself, while simultaneously gathering all of this knowledge about how to do the same thing and show up for my clients, and hold space and be able to be the permission slip for what they were able to do for themselves too. And recognizing, how important it is for nervous system regulation, and how stress management wasn't just, I'm going to put on my Headspace app for, 10 minutes a day and check the box on it, right? It was like, what does this actually mean? How am I actually feeling about the things that are going on in my life? What are the things that I'm internalizing about stuff that's happened in my past? And how's that showing up now with the way that I want to control everything? And when things were no longer in my control, how did I choose to show up then? And just getting that perspective was hugely beneficial. So similarly, but different. It's like both of us had this obstacle that we had to overcome and learn a lot of lessons from, but in a way that allowed us to get really, really clear on our craft, just hone in on like, because we were so passionate about it and wanted to be able to provide the same thing that we were doing to heal ourselves for other women.
And I think there's two important things in both of our stories. One, neither one of us were looking for help for weight loss. I think a lot of times
Yeah.
people think I don't need a health coach if I don't need to lose weight. Wrong. Like, yes, we help people lose weight all the time. We've helped Molly lose 80 pounds and she's kept it off for 4 years. Like,
Yeah.
if weight loss is your goal, we are your gals.
That's like the tip of the iceberg.
Right? Like, what we do is so much deeper. So that's one thing that I want to acknowledge. And two is neither one of us got where we are without having help. You you've had your own mindset coach. You've had me as your health coach and your functional medicine provider. Like, I went through, I don't even know how many different health coaches till I found the right one. Like, I tried macro counting and I tried elimination diets, and I went to Wild Health and paid a lot of money to do some functional medicine stuff. And like,
Yeah, like before you, I worked with probably like 5 different nutrition, wellness, health coaches until I was
yeah,
like, no, I need it has to go deeper. Like I need
yeah,
more.
yeah. Like, so we've also like honed in on our craft, done the education, but then also like we know the value of it, and we know that,
Yeah.
you know, I think that's why we're so different, is that like we've walked the walk and we've lived in that, and we know how important it is to find out the why. And like, we built this because we know that you're being dismissed and that your symptoms are being normalized and that you're going to the doctor and you're getting a 10-minute conversation and it's not their fault. It's the way the system is built. And even if the system wasn't built like that, you can't see your doctor once a month and expect to execute a plan that they're giving
Right.
you. Like, you just can't do that.
And
So
they
I
don't
think,
have all the information. They're getting just
no.
based on what they're able to get from you that's imperative to their agenda in that 10-minute appointment at the time. Like they don't have the big picture.
No, and I don't like, even our clients, I don't think they realize how much back end information that we get before we even get on their lab review calls.
Yeah.
Like, a lot of times they're 4 weeks into our program before they meet with a nurse practitioner. So I have 4 weeks worth of information that I have sifted through. Like, their initial,
Intentionally, like we set it
yeah,
up that way on purpose. Same
yeah,
thing, like they
like,
don't come to mindset until 4 weeks in because we got to
yeah.
see like how they're operating, get some like some intel, you know?
Yeah, like, I know I've watched their enrollment call. I've watched some coaching calls. Their coaches have given me insight. Like, I don't need to spend hours digging through their lifestyle because I already know what it's looking like and I already know how to fix it. I already
And
know
you
that,
already know what they're struggling with.
and I already know that their health coach is going to follow up with them to make sure it's implemented. And so there's a ton of misconceptions when it comes around health. Like, I'll hear a lot of people say like, I just need more discipline. And yeah, maybe you do. Like, in reality, you probably do need a little bit more discipline, but you
Yeah.
probably also have some biology stuff that is going against you, right? Like, I went to the doctor and they said my labs are normal. Okay, well, the range on Quest is sickest of sick to healthiest of health. So yeah, you're normal, but are you optimal? No.
Right. They've probably never even seen like an optimal range, right? Or like the whole idea that, oh, it's just my age. Like this is just something I have to deal with.
Or like, we'll do their lab review and they'll take it to their PCP and they're like, my PCP says that I don't have that, or that you're over treating my thyroid and all that stuff. I'm like,
Mhm.
why? Like, if you wanted your PCP's answers in the first place, why didn't you go there? Like, they're not trained the way that we are. Like, they're gonna tell you your labs are normal. They're not looking at it from a functional lens. Or, people will be like, if something was wrong, my doctor would have caught it. Well, your doctor's taught to
They're not
treat
looking for
disease.
it. They're not looking for
Yeah,
it.
yeah, like, they're taught to treat disease, not
Not to
prevent it,
prevent it.
not
Right.
to stop it when it's first happening.
Right.
And this is like, we do this every day. Like, I had a client today with like perfect labs, but her issues were gut health, and I'm like, yeah, you don't have any estrogen, so you have no stomach acid. There's your issue. We'll have people with like optimal thyroid function, but no one's testing their thyroid antibodies. I'm like, you have an autoimmune condition. Like, if you don't produce something now, you're going to have hypothyroidism. Your insulin's 23. You're not diabetic yet, but in
Well, and
5 years, you will be.
how many people that do have, hypothyroidism or that are diabetic, like could have been prevented?
Yeah. Yeah. I mean, there's just in the health coaching, I made a Facebook post about this to do and today about how health coaching needs a rebranding, like, needs total rebranding. Like, there's such a huge health coaching misconception. Like, it's such a big branding problem. And so when
Because
people
it's all
hear,
targeted around weight loss.
exactly. Like, and when people hear the word health coach or nutrition coach or whatever, they think like, okay, I don't need someone to tell me to go drink more water or go for a walk or to stay consistent. And I get it, because a lot of these online programs, that's what you get. You don't even get to interact with a real human being. Like, you fill in a checkout form and
Right.
they review it over a Loom, and that's your check-in.
Yeah. Or they send you like messages and probably half of it's AI.
Right. And so people really minimize the value of coaching because they don't understand it. And as a provider, like, I am so good at diagnosing, and I am so good at building you the best treatment plan. And I am so good at knowing what's going on in your body and how to fix it. Even if I visit with you once a month, which isn't realistic, I cannot hold you accountable to your daily habits. I can't help you navigate when you're falling off. I can't support you on a random Tuesday when your world is falling apart. Like, I can't. I can't support you when you just ate something and you're, oh my gosh, my stomach's a mess. I need to talk through my health coach and figure out what it is that triggered this. Or last night I got no sleep. I need to check in with my health coach and figure out what happened yesterday that kept me up all night.
Yeah,
Or
because there's a big gap there. And this falls into the same place of women will say this all the time of like, I know what to do, but I'm just not doing it. That's what a health coach is supposed to be for. It's like, yes, we have the knowledge and we have the resources to be able to help you iron out a plan that specifically is what you need to do, because more than likely you're comparing your current plan based off somebody else's plan that isn't going to work for you. But not only do you get the tailored plan that is going to work for you, you get the support to be able to actually do it, to plug it into your life and execute on it, and then be held accountable for it.
yeah, and so let's talk about, let's break it down with certain conditions. Like, okay, you have insulin resistance, and I find this out on your labs. That's a pretty easy one to just tell you what to do. Like, go for walks after your meals, take some berberine, change up your diet. Okay, I'm doing all of those things. Okay, well, let's put on a CGM. I don't know how to interpret a CGM. Okay, that's where your health coach comes in handy. Then let's look at adrenal issues, because 99% of our clients have adrenal issues. I cannot tell you how to fix that adrenal issue on a call. I'm sorry, but I can't. That is working with your health coach day in and day out
Yeah,
to
you
see
have to
what daily
identify
habits.
what's happening. Yeah.
Yeah. Is it that you're drinking caffeine on an empty stomach first thing in the morning? Is it something in the middle of the day that's triggering a stress response? Is it something in your nutrition, your training, your sleep, like, I cannot figure that out on a call. That's where, like, so I'll at the end of lab reviews, a lot of times I'll get, well, what should I be working with my health coach on? Sister, they need to know what you're doing 24/7 so they can help you pinpoint what is causing these issues.
And I think that's a common misconception, or and even like manifests as a frustration down the road, because a lot of women do not, I mean, people in general do not fully understand all of the nuance that's involved in human body recomposition. Like, there are a lot of variables, not only variables that are internal, like what's going on inside your body, but also external variables, what's happening in your environment, what's going on in your daily life, what are the things that are causing you issues or that are interrupting the opportunity to execute on the habits that you need to be doing to move the internal numbers. So there's lots of variables to monitor, and that can sometimes be overwhelming, especially if we're trying to change everything at once. So a health coach also helps you map out what are the realistic opportunities that we're going to make the most out of early on, and then how can we kind of layer in these other things. We can try to change some stuff all at once if that is realistic for you and sustainable for you, but that's not the case for everybody. And yeah, that also comes with managing expectations. If we pull all these levers at once, yeah, we can move the dial forward probably on results. But if that's not realistic, then the results are going to elude you because it's not sustainable for you and your body and your life as you are right now. So that's where we have to adjust, and then also adjust expectations as we do that.
And that is why we get so many people that come to us. They're like, why can't you just do the lab work and meet with me? Because it doesn't work. It
Like, we
doesn't work.
could, but it wouldn't serve you.
Like, yes, there is an execution layer to this. There is, but there's also a layer of understanding your history and patterns. There's a layer of working with you in between visits. There's a layer of how to overcome actual real life barriers, how to actually like do the things and clear up the confusion around things. Like, I know if I gave someone the information, like, I know a lot of stuff these people don't know, like, you guys don't know a lot of stuff. If I went through a lab review and got off of it, my head would be like spinning. Like, what did she just say to me in English? Right? Like, you need time to process that stuff.
And a lot of times you need support to be able to help break through it. and understand fully, like, meet you where you are and understand, how does this apply to me right now?
This is where most functional med fails, and why people have been like, I've done functional medicine before and it doesn't work. It's because they're literally like handed a plan and then left to figure it out alone. And then they're like, I don't believe in functional medicine. It doesn't work. Like, health coaching doesn't work without the functional medicine side, and functional medicine doesn't work without the health coaching side. And it doesn't work without the mindset piece either, because I can't tell you how many women are stuck until they go talk to you.
Yeah. Yeah, because at that point, then we're looking at, okay, now we have a clear plan of what you should be doing specific to your body and what works for you and what your body needs. Then we look at your health coach is helping you adjust based on everything that's going on in your life right now, and what can we apply right now, and what's realistic for you, and what will you do. And then our mindset coach is looking at, what are the things that have happened throughout the course of your life? What are your lived experiences that are informing the doubt that shows up today that holds you back from actually executing on the stuff that your health coach is trying to get you to work on?
Yeah. So we do all of that. Like, you're going to get a huge comprehensive lab panel. You're going to get a deep dive consult. You're going to get a personalized protocol, but then you're going to get someone to support you every day, meeting with you like physically for 30 minutes, not physically because but whatever, it's via Zoom.
Virtually, but live.
Virtually every week. And then you're going to get Lakin or one of her amazing coaches to really help you dig through that underlying trauma and negative things that are setting you back. And this is not
self-sabotaging patterns or struggles with discipline. Like, how many women have issues with control, right? I'm very familiar with that. Like, so many of us are. Like, all of that plays a role in this journey, and it cannot, like you said, one does not work without the other. It's comprehensive.
Yeah, and it's a system. It's not a quick fix. Like, if you want to lose 20 pounds in 4 weeks, I'm not your gal.
No.
It's not going to be sustainable. So if you are a client working with us and you like, take this to heart, it's not a quick fix. Like, know where our heart is. If you're someone that is thinking about working with us, like, hear our heart in this and really understand what we do. And if we're not the right fit for you, go find someone that is, because I promise you, if you're struggling, you need help. Like, don't try to figure it out on your own and puzzle piece it together. Go get the help that you need. You're worth it.
Yeah. Yeah, because I always say, the time is going to pass either way. The time is the only uncontrollable. And it's like, whether you are continuing to shift back into old patterns or stick with what's familiar, and even though it's not working for you or getting you to where you want to go, or you're just trying cheaper fad options that you're telling yourself are going to be the answer and the quick fix or the easy button, or you're taking the time to self-experiment with professionals that are going to help to guide you towards an outcome that will actually be in your favor, even though it might take a little bit longer. The same amount of time passes either way, regardless of which of those options you choose and how you're going to spend it.
Yeah, but like 6 months from now, how much worse is your insulin resistance?
Right.
And then it's going to take us even longer to get you out of it. Like, are you in stage 1 adrenal fatigue now? And then when we get you, finally you're in stage 3, and now we've wasted 6 months, and it's going to add 3 more months to your treatment plan because you're that much further down the road. Like,
right. But it's hard to see that when you're in it. Right. So it's like, for the ladies that I feel like get into it and they're struggling because they want so badly to see those results that give them that little bit of certainty that they're going to hold on to, because they're telling themselves they need that for motivation. It's like, okay, but what's the alternative? What would you be doing with the same amount of time if you weren't moving the dial in this direction? And can you be honest with yourself about the certainty is going to come when you have those internal results that will eventually manifest into the external?
Yeah, exactly. So hopefully through all this, you learned our heart and you learned our story, and you learned that you're not alone, and that we're like literally doing this with 500 women right now. Like, we're literally changing their lives right now and getting amazing feedback and getting them amazing results. And, if we are working with you, we love working with you. And if we're not, we hope someday that even if you don't get to work with us, that this resonated with you and it got you the help that you need.
Yeah. We have so many resources. So take advantage. And if at some point it calls to you, please do not underestimate the power of that level of support, because it really goes a long way. You maybe just haven't found the right approach yet.
Yeah. So as always, little different episode, but sometimes we need to go back and share that, like, why we do what we do instead of like crazy science. But I'm sure we'll get back to a sciencey one next week.
Yeah, stay tuned. So please rate and review, subscribe, make sure that you leave a 5-star review. We really appreciate it. It means the world to us. And we'll see you next time.
Bye.